Well, thank you all for joining us this morning. I'm proud to have some true champions for women's health here with us today, including Barbara Martin, the CEO of West Suburban Medical Center, Acting President Barbara Belcourt-Wachton of the Illinois Council of Certified Professional Midwives, Vice President Carrie Vickery of the Illinois Friends of Midwives, and Hannah Landis and Rachel Wickersham of the Illinois Council of Certified Professional Midwives. And of course, today would not have happened without the remarkable leadership of Senator Cristina Castro and Leader Robin Gabel, who delivered enormous support in the House and the Senate for this bill. I also want to recognize Leader Mary Flowers and Representative Anna Muller and former Senator Iris Martinez, who were the early initial sponsors and supporters of this legislation. Bipartisan progress on women's health is a victory that we should all be very proud of. I thank every sponsor of this bill for pulling the General Assembly together on this issue and finally getting it passed. In that spirit, the bill I will sign today affirms a message that I hope every Illinoisan can get behind. Reproductive health is not one size fits all. Whether it's an expectant mother with a pre-existing condition or a woman looking for culturally informed care, these deeply personal needs and procedures require comprehensive options. That includes the services of traditional midwives, whose guidance before and during delivery, as well as for vital postpartum care, can be life-saving. It's all the more notable in light of our nation's tragically high maternal mortality rates, especially among Black and brown mothers. But in Illinois, up to now, midwives have been unable to coordinate with hospitals, doctors, and pharmacies to provide these critical services for their patients. That's not safe for mothers or their babies, and it's time for a change. With this legislation that I get to sign today, Illinois will formally recognize and license certified professional midwives, credentialing medical professionals who perform out-of-hospital births. Starting in the fall of 2022, the life-saving and life-giving work midwives perform will be legally recognized here in Illinois. And we are setting standards for education and training that will ensure that they are equipped to serve. It's a victory decades in the making and one that recognizes the full worth and value of midwives in reproductive care. Most importantly, it ensures safe home births for every mother who chooses to deliver out of hospital, another step toward advancing health equity in communities across our state. As governor, I've made clear that Illinois will always protect women's health. That includes a woman's right to safe and accessible maternal care. That's why, in partnership with the General Assembly, I've made Illinois the first state in the nation to expand comprehensive Medicaid coverage for up to 1 year of postpartum care. I've required the Departments of Public Health and Human Services to expand their best practices and programs to better serve high-risk pregnant and postpartum individuals. And we've covered doula and other home visitation services under Medicaid. And we're not done yet, because Illinois is important in its standing up for women's rights. A woman's right to safe and accessible maternal care ought to be a fundamental right. With that, I want to turn the podium over to one of the leaders who made today's progress possible, and that's our leader, Robin Gabel. Leader?
Thank you, Governor.
Thank you.
Well, thank you, Governor, and thank you for that comprehensive review of everything we've done for maternal health over the last couple of years. Really appreciate it. This bill is very near and dear to my heart. Prior to becoming a legislator, I was the executive director of EverThrive for over 20 years. We advocated for increased healthcare resources for women, children, and families, and won Medicaid reimbursement and expanded practice for nurse midwives. Improving maternal health outcomes has always been a top priority of mine. With the signing of this bill, certified professional midwives will gain the recognition they deserve. They are professionally trained to deliver home births, and this bill will allow them to be licensed to do so in our state. Home births with a certified midwife offer a safe alternative to a traditional hospital setting. And I'm glad that we are making this option official. This has been a long time coming. It was one of the first bills that I carried when I became a state representative, and I am so proud and honored to be here today. Thank you, Governor Pritzker, for all that you do, and thank you to all the advocates for your perseverance. I know it's been a long haul. I would especially like to thank Bucola Bello, Sue Clark, Aaron O'Brien, Phil Milsk, Carrie Vickery, and Barbara Belcour-Walkden, who sat at the virtual table and worked out the details of this bill in the summer and fall, and it was about 9 months that we birthed this bill. A special thanks to Leader Flowers, who was the first sponsor of this legislation to license certified professional midwives. I appreciate her perseverance over the years as well. You know, all our hard work will ensure that expecting parents will have another safe option for bringing their babies into the world. So next, I'd like to introduce Leader Flowers, who is our esteemed longest-serving member of the GA. Thank you.
Good morning, everyone. I want to first thank Governor Pritzker for signing this important bill today. And although our work is far from done, this really is a good first step. As most of you know, as it was just stated, that I am the longest-serving member of the Black Caucus, and it's been over the last 2 decades that I have been working on trying to provide the best type of care for maternal mortality, because so many women and children were dying over 2 decades ago, and it wasn't being talked about. And so as a result of this bill being signed today, hopefully because of choices and cultural sensitivity and respect, hopefully we will hear about very few mothers dying, something that did not have to happen or should not have to happen. And so once again, I want to thank the governor. I want to also take this opportunity to thank Leader Gable, Representative Moeller, and someone that a lot of people don't know about that was a part of this back in the day was Congressman Jan Schakowsky. She too took a lead in this very important piece of legislation. So once again, this is a good first step, and I'm looking forward to making healthcare better for all the women, but specifically African-American women, because we're dying at a higher rate, and it's all preventable. Thank you very much. And the next speaker will be Senator Castro.
Thank you, Leader. Today's historic. If you've talked about how long it has taken to get this bill across the finish line, many conversations. You look at many of my colleagues, some who are dearly departed, and Senator Bill Hayne, as well as now Clerk of the Circuit Court of Cook County, Iris Martinez, but many women who are standing here who have been a part of that fight, Leader Flowers in particular. Thank you for your leadership in that. And one of the things, as Leader Flowers had mentioned, we're still a long way to go. But I'm proud to say today, Illinois takes a very bold step compared to other states in the nation to lead and giving women the choices of maternal care. This was not an easy bill, but it was one that we will enjoy watching the governor sign. Thank you to Governor Pritzker and his administration and everyone who has tirelessly worked to advocate for women and women's health care. I also see one of my constituents who, when I first got sworn into the General Assembly, that was one of the first issues she came to talk to me, Karen Bachman. Thank you for working very hard on that aspect. But again, this is a monumental moment. And one of the things with the COVID-19 pandemic, which has shown the importance of giving people options in their health care. For those who have lost trust in the traditional hospital setting, home births may feel more comfortable, and making sure those who are there to take care of them in this crucial time are certified and safe is so, so important. So again, thank you to everyone, my colleagues in the General Assembly, Leader Gable, Leader Flowers, everyone who has played a part in making healthcare our #1 priority in Illinois. Thank you so much. Next, I will introduce Barbara Martin.
Thank you, Leader. Thank you, Governor Pritzker, Senator Christina Castro, Representative Robin Gable, Representative Mary Flowers, and all of the elected officials who co-sponsored this legislation. Thank you for your unwavering support and dedication to all the expectant mothers, hardworking midwives, partnering hospitals, and dedicated OB/GYN physicians in the state of Illinois. My name is Barb Martin, and I'm the CEO of West Suburban Medical Center in Oak Park, and we serve both Oak Park and the West Side Austin area. West Suburban has offered comprehensive health care services to Oak Park and the Chicago West Side since 1914. Today is a proud day for midwives and even a prouder day for West Suburban Medical Center, as our midwifery program providers at PCC Wellness and West Suburban Midwifery Associates will finally join the ranks of other healthcare professionals who are fully licensed and recognized in the state of Illinois. At West Suburban, we respect birthing rights to select healthy birthing alternatives. We're proud of the accolades recognizing our efforts, which include the partnership with 2 midwifery programs, which midwives do over 30% of our deliveries. In 2021, West Suburban earned a spot on Newsweek magazine's list of best maternity care hospitals. West Suburban also has been named one of the top 3 maternity units in Illinois by the Leapfrog Group that oversees hospital quality across the country. We are committed to continuing to provide competent care as more and more hospitals struggle to keep their maternity units open. We look forward to welcoming midwives into West Suburban Medical Center as a result of the Licensed Certified Professional Midwife Practice Act becoming law today. Now it is my distinct honor to welcome Barbara Belcourt to the podium.
Thank you, Barbara Martin. My name is Barbara Belcourt-Walkton, and I am here acting as president on behalf of the Illinois Council of Certified Professional Midwives. As you can imagine, after 40 years of working on a piece of legislation, there are many people who've put their hearts and hands right into this work. Too many to name, but we would like to say special thank yous to all of our sponsors over the years, especially chief sponsors Representative Gable and Senator Castro, who carried this bill through this session, to Representative Mary Flowers for her decades of ceaseless work on this legislation and other pieces of legislation to help maternal health care take steps forward, and others that lift up the needs of mothers and children, and to former State Senator Iris Martinez, who pushed this bill to the forefront, passing a resolution for a home birth task force that led to this very moment right here. Governor Pritzker, we especially thank you for giving our community of families and midwives an opportunity to be represented in this historic event. With the signing of this legislation, Illinois becomes the 37th state to recognize certified professional midwives as skilled, trained, competent professionals able to serve the people of Illinois. We're grateful for the shared efforts of our fellow stakeholders, including the nurses, physicians, and the hospitals. We know the way forward to integrating midwifery care in Illinois is found when midwives, nurses, physicians, and hospitals can freely share information and work together to improve maternity outcomes across the state. At the heart of all of this effort is the well-being of the families who chose home birth with a provider of their choice, as is their right as a patient in Illinois. The people in our amazing state, regardless of income, race, ethnicity, sexual orientation, or identity, or healthcare coverage, should have affordable access to the provider of their choice. There are not enough words to express our gratitude at being able to bring equity, choice, and competency to everyone's birthing experience through midwifery. We look forward to working with leaders Gable and Castro to expand on policies and practices that uphold the midwifery model of care. Thank you, and congratulations to everyone. Now I'd like to welcome back Governor Pritzker for his signature.
You may want to take a picture, all of you together with this, holding up the bill. There you go. Yes, ma'am. Leader. Great, we can do more after. Thank you very much. Exciting. We'll do that afterward, for sure. And of course, you will get the first one. Leader, thank you. Happy to take any questions from members of the media.
I just wondered, does anyone? You can?
I can a little bit.
Could you give us just a little bit in Spanish about the meaning of why this is so important? I appreciate it.
Ya, una de las cosas que es muy importante de esta legislación es mujeres que van a tener niños, ya tienen, pueden, I'm doing this on the spot, sorry. Pueden escoger cómo tener ayuda. Muchas personas latinas tienen no pueden, tienen acceso para, let me do this afterwards if I don't mind. I'm trying to do it, my thing is I'm trying to translate in my head and I need. No, that's fine, we'll do that, we'll do it afterwards. Let me go look to the governor.
That's right, great, thank you.
Sorry, yeah, I'm trying to do the translation. in my
Your
head.
Spanish is better than mine.
Governor
Great.
Pritzker, I have two questions. First, the New York Times article, I'm sure you saw it 2 days ago when they talked about President Biden if he bows out of the 2024 election. They wrote that you spoke privately about your interest in seeking the White House and that you're happy to consider this if the opportunity arises. Is that your futuristic? Did it 1,600?
I have never spoken privately with anybody or publicly about that, first of all. And second, I love my job as governor of Illinois, and I intend to keep doing it on behalf of the working families of Illinois, making sure that we're lifting up our children, making sure they get the education that they deserve, that families get the health care that they need, and that we're growing our economy and, of course, working our way out of this pandemic. So I'm going to continue doing the job. I have no intention of running for anything except re-election as governor.
No one has ever approached you and said, hey, you should consider running, you'd be good.
There, of course, people have mentioned this to me on occasion, but I've never had a conversation with anybody about it.
So you're saying that your political ambitions stop with being governor?
I am focused on this job. I love this job. I really love the job of being governor, and I'm going to continue doing it as long as I can.
What was your experience, but you were so involved with Hillary Clinton's campaign? What did you take from that as far as how difficult it is to run?
Look, it's certainly instructive to watch how difficult it is for someone to run for president. I ran for governor. That was a difficult endeavor as well. And we're going to do it again during this coming year. So, I've learned a lot over the years. I ran, as you know, for office 20-plus years ago and learned how hard that can be, too. So, look, I'm focused on this job and this job alone.
But if drafted,
There's no, look, folks, I think I've been pretty clear about this. I want to be governor of Illinois. I want to continue to be governor of Illinois. I'm doing the job that I love.
What happens if?
All right, you're all kinds of hypotheticals. I get to spend more time with my family.
I wonder what your family says about all this too, because you were rather reluctant even to say, beginning of running for reelection, you must be having some conversations. Hey, guys, the New York Times is not just a local paper. I mean.
I think I'm being pretty clear. That's about all I have to say about it.
While we're talking politics, probably an easy one for a Democrat. Darren Bailey was criticized yesterday because his choice for lieutenant governor has a past of not being sufficiently pro-Trump enough. Any thoughts about what's going on in the Guilty primary?
It's a complete mess over there. I do not know how they're going to resolve all of this. The cult of personality around Donald Trump is a major factor in the Republican Party, seemingly, and I think they're going to have, lots of disagreements about, who's more Trumpy than the other person. But I know what I'm focused on, and you know what I'm focused on, and I've been doing it for the last 3 years, and that's just the people of Illinois, the working families of Illinois, the children of Illinois.
Both the governors of New York and California have implemented mask mandates, but both of their governors have given their people end dates of January 12th. What about giving Illinoisans an end date? Rossborough, because I brought this here, but these are,
So,
Washington DC doesn't have an indoor
look,
mask mandate.
here's why we have a mask mandate, because we need to keep people safe. We need to stop pretending that masks don't work. They do. That countless studies show that masks do work to reduce the transmission of infection. We also know that the most important thing you can do is to get vaccinated, and if you've been vaccinated, to get boosted. That is what keeps people out of the hospital. It's what keeps people safe. And so I encourage everybody to please wear your mask indoors. Please make sure that you go get vaccinated if you've not been. And if you haven't had your booster yet, we just opened booster shot vaccination clinics across the Cook County, as well as in other parts of the state. We have vaccination clinics that are open to people who want to get boosters. So I just want to encourage everybody to do the right thing. We are in the state of Illinois, and we're going to keep doing it. And following the science, I might add.
Wait, but we went from 300 cases in Chicago to 1,000
Look,
cases a day.
every time the numbers go down, you say you want everybody to take the masks off. Every time the numbers go up, you say you want everybody to take the masks off. I know what you stand for. Let's keep moving on. I'd like to talk to reporters.
Craig?
Can we just ask about hospitalizations continue to go up? Is there anything more that could do or thinking about doing that would help mitigate that?
We're doing it now. So let me just run down the list of things that we're doing. First of all, we've made boosters more widely available, because that really is getting vaccinated, getting boosted, the most important thing to keep you healthy. Second, we're making sure that monoclonal antibodies are everywhere in the state. And that's not a small feat. It's hard to get a hold of them. There's a bit of a shortage of monoclonal antibodies, but we are managing that throughout Illinois. We're also making sure that the new pills that are available, that are a treatment, although they are a little less effective than the monoclonal antibodies, they're still somewhat effective. And so we want to make sure that those are getting to hospitals across the state. And then, once again, reminding everybody, especially in this holiday season, especially as it gets colder, that if you're going indoors with lots of people, especially people you don't know, please be extra careful. Please do go back to social distancing. Please wear your mask if you're with people you don't know, whether they're vaccinated or not. It's very important that people just take extra precautions, especially now, because yes, our hospitals are filling up with unvaccinated people, I might add.
Can you give us any kind of latest on the tornado? Are you concerned about that Amazon facility, those reports, and I'm not positive that they're accurate, but there are reports that people are not allowed to have their cell phones while they were working?
I was told by Amazon officials that that is not accurate, that they used to have a policy pre-pandemic where people couldn't bring their cell phones onto the floor. When the pandemic began, they let everybody bring their cell phones onto the working environment. But that's up to them. That's my understanding from what they told me. And by the way, there were tornado warnings that were issued many minutes before the tornado hit by the local authorities there with prompting from the National Weather Service. So that's what I know. But let me just say this. 6 people died, and they died in a horrific, severe storm. I stood there in front of that building and saw it tore through a whole section of that building. And people who were huddled together in the only structure that they had on that side of the building all passed away because the tornado was so severe that it brought down walls, and those walls came down exactly on where people were staying. There is one person that survived among the 7 that were there, and he is in the hospital now and hopefully recovering. I know that there are surgeries ahead for him. But I think, we all just, in this holiday season, I think I'd like to ask everybody just to say a prayer for the families of those that were lost, and of course for the gentleman who's still in the hospital.
Governor, with so many of these warehouses going up, not just Amazon, but others, does there need to be approach to how these go to help them better withstand severe weather?
Well, we're relying upon not only the local investigation, but the OSHA investigation to look at issues around whether there are structural challenges with the way those warehouses, and that particular one was built. People have said that they were built to code. If they were, then we need to look, and I've talked to legislators about this, we need to look at whether the code needs to be strengthened. Because I think we all are quite well aware that storms are getting more severe, that climate change is affecting businesses and homes and individuals all across the nation, not to mention here in Illinois. And so if we need to strengthen those codes because of climate change, we should go do that.
Governor, given that, you'd also be evaluating whether or not companies should be allowed to have policies on the books that keep cell phones off the person of individuals. If there are places where that is on the book, out of earshot, those cell phones are lifelines, should we be looking at that too?
I suppose so, but I can imagine different circumstances where it may be inappropriate to have people carrying cell phones, on the premises. But you're right, questions need to be asked. I think they are being asked, and Amazon, of course, is being asked those questions today.
And one question on the pandemic. Yesterday, the mayor said Mayor of Chicago said that the city's looking at some policies, potentially modifying mitigation, given the numbers that are going up. What would be first on your list as far as changing mitigation? What would be the top of the pyramid, and have you had any conversations with?
I have not directly recently had a conversation with the mayor about the mitigations that she's considering. I do encourage local officials, based upon the transmission rate and the infection rate in their local area, to consider more stringent mitigations than what we have for the state. But we have some of the most stringent mitigations, and that is wearing masks indoors. That is what the mitigation regime needs to be. Get vaccinated, wear a mask indoors, please socially distance, especially if you don't know the people that you're with. I know that people are gathering during this holiday season. Just be extra careful.
We'll do one more.
Vaccine cards at restaurants.
I've heard that that's something being considered by the mayor. I've also know that New York City is now requiring that, as I understand.
Do you support that?
That's not something we're doing at the state level, but again, I think at the local level, people should, consider whatever mitigations will be most helpful for their local citizens.
All right, thank you, everyone.
Thank you.
Okay.